Thank you for being patient. We've got another group wandering in, but we're going to go ahead and get started. We're a tad behind schedule, but given all that we've done over the last 2.5 days, almost 3 days now, I think that's not too bad. So this is the session where we do the wrap up. Imagine that, end of the conference. So we're going to start with a little bit of the synthesis from what you have provided to us through the breakouts yesterday. We're going to hear a little bit from what you said on the survey. And then we're going to have a discussion about where we think we're going next in the future. So we really appreciate that you are still here with us, that you came at all, and we are going to have a really open dialogue, I hope, with you over the next hour, and then we shall call it a day. So I think without further ado, let's just jump on in to Yep, I forgot about that. Okay, so there you are. Okay, so we're going to have a bit of an update, just a reminder on the site visits and a few changes, so pay attention.
Okay, hello everyone. We have some change about site visit location. So the first, right now we are here, the forum venue and the graduate house. Later, tomorrow morning, we'll meet at Hong Kong U Metro stop, the MTR station, the exit A1. Okay, so you can see there's a picture here showing the A1, the ground floor of A1. Okay, and then later our student helpers, RAs, will escort you to the Hong Kong U East Gate. So first we should meet here at around 8:45 a.m. And then later we'll go together to the Eastern Gate at 9 a.m. and the bus will pick up us from there to the different site visit. Okay, do you have any questions? Yeah, is everybody's already signed up? You know your which site visit you would like to prefer or would like to do to go? Name? Yeah. The helpers and drivers will got that. Yeah. Okay. So if no question, then I will let Julie continue. Um, yeah.
Okay, you guys. So just remember that when we set out to do this meeting, we have an interim steering committee. We were setting out to kind of see if this kind of a network was needed. And what you're going to hear back is what we think we've heard from you. So when we ask for input, this is your chance to please say, yes, we missed something. No, we forgot it. We meant this. Yes, I'll do that, volunteer. So this is our network, and we're in it together. And unless you do the unsubscribe, you're officially a member of the network. So now you're in. Why don't we go ahead with so now we're doing the results, just the next steps for Jen from the breakouts yesterday. I know there are a lot of key messages. Let me just say that there is a document. Joy's going to go over some of that in a minute, but I know in each of the sessions you had key messages and action items, and what you're going to have right now are just the action items, the next steps, so that we can sort of see where we're going as a community and what we want the network to do over the next year. And after today, we will have all of your input. We will take that, we'll have some agreement on sort of the big picture of where we're going, and then we'll take the content and turn it into an action plan, which you'll have a chance to review. So I think just the goal here is to make sure that we've got the action plan organized, the key messages you'll have a chance to review, but we're not going to go over every single one of those today. We just don't have the time. So with that, we shall test my skills again. All right. Shari? Looks like you're up first. There you go.
Okay, so this was the session on Tuesday morning where we looked at health impacts and vulnerabilities and really the kind of underpinning science evidence base. So just to do this very quickly, training needs, particularly around epidemiological methods. So I know there's a lot of discussion around quantifying, and so this relates both to kind of capacity building, transfer of skills, training needs, but also there's a general need for more consensus or more kind of, what's the word, more systematic approaches. So to allow, which will, sorry, it's the wrong time of the day for me completely, and my brain's not working. So in relation to training needs, and we know that some people in the room already have some of these training tools, particularly around time series available, that could be used or transferred. But also there's a general need to improve consistency and in terms of definitions and outcomes, so that would also achieve that goal. It's 2 years currently planned until the next forum, so people would like some regional meetings, so that's clearly something that could be taken forward. Collating evidence reviews, although they can't actually be done within the network, a lot of people are doing their own evidence reviews, and it's important that people understand what evidence reviews are being undertaken to avoid duplication of effort. And as was also mentioned on Monday, WHO Europe has a plan to update its heat action plan guidance. This is kind of being formulated at the moment, and clearly that would be one mode for evidence reviews, because that would be a technical update, but clearly it's more relevant for Europe, so there are issues about how other regions could update or add to that, given that there's important regional differences. And also we had a lot of discussion around the physiological evidence, because I think one of the key messages is that this does need to be updated, so a lot of messaging isn't reflecting the latest physiological evidence, and so there's a clear need for that to be done, although the mechanism to do that needs to be kind of resolved. And another thing that will probably come up in a lot of these slides is as a repository. So I know that there's funding for the portal, but there are lots of things that could be usefully on there. For example, good practice examples, so what's actually being done, but also things like population surveys, so a lot of things like action plans as well that are generally in the grey literature that are actually very hard to find, so we would clearly benefit from having them in one place, although it of course relies on someone to be very active and update them. And also things like research and methods and tools that we could usefully share. So things like questionnaires. Once you've developed and invested a lot of time in developing a questionnaire, then it's quite useful that other people could use it. And things like study protocols for physiological experiments, and also statistical code. So we know that a lot of the statistical modelling that you've seen, the code for that is publicly available anyway. It's in R, some of the work done by Antonio Gasparini. And finally, who else should be involved? And we had some discussion about how to have better engagement with NGOs, particularly around disaster relief. And also urban planners and some of the housing and built environment specialists could be further engaged, because that's clearly a huge policy area that needs to improve their heatwave planning and understanding. Thank you. Any questions? Anything horrible? I mean, that I missed? Anything that I did horribly wrong? Oh dear. Okay. Yeah, okay. I think some of that will be on the other slides, but on all the other kind of key messages, there's a lot of about intersectoral and multi-sectoral working and general networking, but that didn't get translated into a specific action. But you're absolutely right. So some of this would be around regional networking, perhaps, and establishing national and regional networks where we can make those collaborations. So that could be something we could add. And this one, yeah, this one, this one.
Go ahead.
Yeah. Clearly, there's probably a long list around training leads, so it'd be good if we could capture those. There's one, Virginia and John. The- Yeah, so just these are examples. It's not a comprehensive list, okay? And clearly, somebody's taking notes to get. We know it's a two-way thing because there's a lot of things that the climate people need to know about health. But yeah, Virginia. Yeah. Yes. Yes.
Very good points, all.
Should put
All right.
examples.
Yeah.
Any more questions?
Good.
Okay.
This is good. Make sure that we, got it right.
Okay.
Okay.
Thank
Thank
you.
you, Shari. Yeah, well, you do. So, yeah, you have to sit on the stage by yourself for just a second, because now it's going to be, yeah, for just a second, it's going to be Shubayu. There you go.
So the rest of the world calls it brain freeze, and we in the heat community call it brain melt. It's that collective state that we are in. So this was the session where we were talking about actions and interventions to reduce health risks from extreme heat. These are just some of the sort of the salient takeaways that we had from the 2.5 hours that we were together. We introduced this idea of creating a catalog, a knowledge repository. Knowledge repository sounds better. A knowledge repository of different kinds of interventions, ranges. We talked about a range of interventions, starting from individuals to households, communities, cities, countries, and which reaches different audiences. There was a lot of rich discussion around, specifically thinking about occupational health effects. There was supposed to be a discussion which the person didn't come, specifically targeting healthcare providers, how we train them to identify heat-related illness and help them prevent. We had some discussions around how these different typologies can be designed. Another idea that was floated was we do these by geographies. So essentially we are talking about a portal of sorts where somebody who's interested in heat-related actions and interventions can go through this catalog, go through this portal, and identify what's either happening in the country where they live, or if there's a specific audience that they want to reach to, they can identify what else has happened in the rest of the world to learn from and potentially adapt. There were some issues which are still unresolved, in terms of what we do around quality control. Is it going to be a portal where anybody and everybody can come in and just say this is what I'm doing, or there is individuals who are monitoring the kinds of inputs that are feeded into this portal. So I think those issues need to be decided upon. There are two issues with K-Much which is specifically related to decision makers. One was this notion of expanding capacity to harness the power of storytelling. This is sort of colleagues from the international NGO community felt very strongly about these because often a lot of innovative creative work is happening in that arena, which doesn't get reflected in the academic literature in general, which then the systematic reviews that we talk about wouldn't account for, but something that's important. And for us as a global community, we need to catalog and understand it as well as we can. There was also some discussion around producing some communication material for policymakers, summarizing, the range of health benefits that we already are quite confident of, which, it's again, nothing extensive, but a short, pithy, but hard-hitting, piece, which then gets circulated at the right circles to communicate effectively that health actions have, perceived benefits and, something that is sort of a no-brainer to pursue. There was some discussion around identifying, as a community, providing inputs to identify measurable goals or objectives that countries have already committed as part of their international commitments. So let's say to the Sendai framework, if there is a way that we can, provide some inputs, to individuals in order to push country efforts to produce those estimates, which then, might be useful in various settings. Just in terms of discussions, there were a few things that came up. We definitely identified the relevance and the importance of better estimates of costs, both in terms of the health burden as well as the benefits that might arise from interventions, which would then somehow move the policy dial towards more action, more effective action in some ways. We definitely wanted to expand the range of health outcomes, so move beyond mortality. There was quite a bit of consensus that often it is incomplete, often inappropriate to only focus on mortality, and we really need to consider other health endpoints, ranging from morbidity, hospital admissions, ED visits, to other indicators of well-being. So that's something that we as a group need to collectively think about. And yeah, I guess I'll stop there. There were a few other things, but these were the salient points that I wanted to mention and make others who were not part of that discussion aware of the kinds of important takeaways. Thanks.
Any questions, or anybody who was in the group? Any discussion about this?
Lars.
Thank you. First of all, in regards to the repository, I think it's a really good idea. I have two comments for this one. I think it should be harness the power of good practice or proof of concept examples. Because if it's just storytelling, if it's cases that are not by any way, then I don't think it's feasible for a forum. I agree that we should make it in some way formalized, and it's really strong to have these cases from different regions that would not go into something that will be published elsewhere but can go here, but still is formalized. And therefore I would not say that it's not just storytelling, it is power of good practices or proof of concept in some different settings that then can inspire others. Then also in regards to the last, where it also was mentioned for Sari, it becomes increasingly clear to me that we are so many different disciplines that it will benefit also in this repository to have some kind of framework so we can understand and respect the different disciplines. This is how meteorologist works to provide data of importance for health. This is how epidemiologist works to produce this, and these are the standard guideline for that. This is how thermal physiologists like myself, this is how sociologists work. So if we have that very briefly described, I also think that it can strengthen the ability to cooperate across different disciplines. So that was just two comments. I'm in support of the repository. I just think that it needs to have these quality strength. Thanks.
In that session. All right. Thank you, Shibayu. Hannah?
Hi everyone. So the aim really in this session was to share experiences, as in all the other sessions, but also to talk about and think about what's going well, what's not been going well in terms of meeting the demand, what the challenges are and what the opportunities were. We had an incredibly broad discussion, which ranged from technical details of threshold setting and lead times and resolution, all the way up to, you know, the persistent challenge of working together and getting feedback from stakeholders. And so the conclusions about what worked and didn't work were mostly from within the meteorological community, apart from the couple of people who bravely represented the user side in our session. So consequently, these are also pretty broad next steps that emerged from the conversation. But one is, of course, to continue to provide a forum to share these case studies and experiences. That seems to be consistent across all of the different themes. The case studies that we did have were extremely powerful, and they're extremely instructive to be able to delve into them. So one thing that Jin could do is to basically foster and help to support and develop additional pilots and case studies. Some concrete examples that came up was, so we heard about a Caribbean climate health bulletin that's issued quarterly in the Caribbean. This can be extended to other regions. It's a nice example of how the health sector can work together with the climate sector on something fairly simple and concrete. We talked about identifying a couple of pilot regions for integrating seasonal heat information into humanitarian and local regional planning efforts. And one concrete example was working with the Red Cross to integrate seasonal forecasts and multi-hazard information into planning. But I think another really important one is not all about sort of new products we can come up with, but basically using what we have already better. Can we come up with good examples of case studies where there are existing forecasts and projects have gone some way towards helping people to understand them and use them well? We had a very compelling example from the START network talking about action they'd taken on heat in Pakistan, which everybody found very instructive. So let's find those examples, help to develop those examples, and try and synthesize the lessons learned, and feed those lessons back into the meteorological services. There are concerns about the observational capacity, meteorological observations in many, many countries, that hinders our ability to provide good services. So to the extent that Jin can advocate for that at the higher levels, improvements, that would be really great. Another concrete suggestion was systematically incorporating heat outlooks into the regional climate outlook forums. These are seasonal forums where meteorologists and climatologists get together within regions to make an outlook for the next few months. Currently, it's not systematically including heat or heat extremes, although that's happened in a couple of regions, so that can be scaled up. But then at the other end, there was a lot of conversation around capacity, around what are the obstacles to actually getting proper engagement from stakeholders. And so to the extent that Jin may be capable of advocating at the higher levels, part of the problem that was recognized was that there really is no mandate normally for the meteorological services to engage with the health sector and vice versa. And so that's a major problem because there's no money or funding dedicated to that kind of engagement. And there's a need for capacity building in order to do that effectively, again, on both sides. So I see overlaps again with other themes here. Okay, I will stop there. These are all just things that emerged from the conversation. They're not things that everybody has specifically voted on. So please, you can please feedback, and there'll be further opportunities to refine the actions going forward.
Anna, regarding advocacy for improved observational capacity, it's very well taken. But also availability of observational data, both meteorological and epidemiological.
Absolutely. Yeah.
Unless it is available, it won't be worked upon. So can it be included here or anywhere else that you can consider?
I mean, like data sharing among communities?
Among the communities.
Absolutely. I mean, that would be a really fantastic thing to come out of
be.
this, yeah. But that's also that's something that has to happen at a high level, because ownership can be a real issue, yeah.
We can make a recommendation at least to begin.
Great. Yeah.
Can I just say that it was a really difficult session for you to run, and we were very disparate and had many different opinions, and I think that kind of is encompassed in that slide. So just to thank you for putting all of that together. It was really hard to run. So thank you.
Thanks, Ruth.
I'm just looking in there, I suppose, again, for the way that partnerships are built. Particularly, I'm conscious of the comment about having access to data. I haven't had necessarily to ask for data, but ask for partnerships and then work together on the data so that I didn't... it's different from collecting the data, right? But access to data doesn't mean you actually have to... You just need to work together, have a meteorologist and an epidemiologist working together, and the data is accessible for the study, rather than trying to bring the data into your discipline, rather than, because it's easier to do in the short term, maybe the longer term is this difficult thing about sharing data.
Yeah, thanks, Hannah. Just a suggestion. My organization in Bangladesh is part of a network called In-Depth, which is a collection of longitudinal health demographic surveillance systems across Africa and Asia. If we could get some advice on low-cost weather stations, which could be added to the surveillance sites where we all work, we would immediately then enrich the capacity for doing this kind of research. Because at the moment, we're forced to rely on the meteorological department, but there's a long lag before we can access the data. The quality of the data is sometimes questionable. So I'd like advice on low-cost weather stations, maybe less than $10,000, that could be put in these sites across Africa and Asia, and I think it would really trigger a lot of research on these, crossing over the disciplines.
I mean, that's a really interesting comment, because actually there's, it again gets at this need for GIN to really, for us all to focus on both the local examples and the local issues and the high level stuff, because data in Bangladesh, for example, it's recently been made illegal to install your own weather stations. So you've got to go through the Bangladesh Meteorological Department. So we can talk about it later, but yeah, I mean, the data issues are very, yeah, anyway, this is one of those things that I think we could work on, yeah.
Hi, Hannah. I think these actions are great, and I think it captures a lot of the conversation. I think for the next conference, it would be great to really focus on these partnerships, because I think out of this work, almost everything else stems. You get the lessons learned, you get the communication issues, you know, you have all the conversations about language, and I think, yeah, so it'd be great, you know, to really showcase this sort of stuff right at the get-go of the next conference. Bit of a dream.
Yeah, thank you. And actually there have been comments about, you know, trying to attract more examples like that are going on in the world that haven't been represented in this meeting. So more practitioners, particularly from the NGO, the humanitarian sector, who often then pave the way through examples for the health sector and the emergency sectors at the national and city levels to follow. So thank you for that.
Thanks, Hannah. I was not part of this session yesterday, but building on the question about sensors, I think some people in the room are involved in collecting a different type of weather and climate information with sensors in people's homes and in neighborhoods and on telephone poles and so on. And I was curious if there was any discussion about those types of data and how they fit into this network and how we can leverage them and so on.
There wasn't actually any discussion around those issues, but for next time, there's loads of great work going on, hard to cover in a short time. Okay, thank you.
Great job. You can see some common threads throughout, which is also nice to see.
as we would say in New Zealand, kia ora, hello. This session was all about how do you get married, and then how do you celebrate your diamond wedding anniversary. So, a good marriage, the heart of a good marriage is a good partnership. So, this is what we weren't focusing on marriage per se, of course, but partnership. Marriage is a good analogy for partnership. When I was a student, I was not very good at answering exam questions, so I've got more than one slide, so apologies for that. I started off a presentation, I think yesterday, I can't remember, or the day before, with this slide, which is from the Global Framework of Climate Services, the value chain linking climate knowledge to action. Notice the arrows at the bottom of that chain. All of us fit into one of those spaces up there, one of those action and knowledge generation spaces. But notice those arrows at the bottom. We've got partners and partnerships there, research partnerships, development partners, and also the role of the private sector. So I think this is an explicit acknowledgement of the importance of partnerships. So in the partnerships and capacity building session, what came through as being fairly obvious, well, the need for partnerships resides in the fact that the heat health problem is very complex and no one discipline, agency or group can solve this so-called wicked problem. There's, encouragingly, there's evidence for emerging partnerships to address heat risk, some key partnerships being developed in research, so key research partnerships, especially around developing integrated data sets, marrying the epidemiological data, the health data, with the climate data. In fact, a little bit of a diversion, I have a proposal for a new discipline called epiclimatology. There we go. Need for it's obvious there's need for partnerships in the emergency services sector. Also, it's very obvious there's a need for partnerships around the urban planning, health, climate, housing space. So partnerships between these important sectors. Maybe regional partnerships as opposed to global, not saying global partnerships are not important, but maybe regional partnerships is a way forward. And also, to create effective partnerships, we need clear governance. This is very important. So what do we need to do? We need to focus our efforts to establish clearer mandates, and this is coming through very clearly in other areas which we've been looking at over the last couple of days. Mandates for both action and also mandates for engagement, either interdisciplinary engagement or intersectoral engagement. Also gauging at the macro level, the UN level, to get heat health onto the international agenda. So a little bit of lobbying, political lobbying is required here. Engage in the Sendai framework, even though we've called it the global platform, to highlight fundings, the merging from the GIN network and linking these three through to the sustainable development goals. I think it's fairly clear that heat as a risk has a big impact on human development. Early warning system meeting that's going to be convened by the WMO in Geneva, perhaps Kumar, is it? We'd like to get GIN involved in that. Also engage in the urban sphere, maybe through UN Habitat Program and Urban Adaptation Forum. Also look at potential for engaging high-level policy framework in New York City. And let's be aspirational. Let's get GIN off to COP25 or COP26 in London and get ourselves on the international stage. Last slide. Develop specific criteria for what partnership entails. What are the critical things that make for a successful partnership? This is the marriage factor based on very good practice that has emerged from the Red Cross. They have very good examples of how to develop partnerships. This is more to inform GIN. this is not prescriptive criteria for others to develop partnerships. It's more to inform ourselves, and also there's good lessons emerging from how the England heatwave plan has been put together, and also how Red Cross is operating, and also the US NICES endeavour. Also engaged with Wonka. We had a very good presentation from the global network of GPs from Donald Lee. There seems to be a lot of potential for Jin to engage with Wonka, and also scoping out a work plan of engagement with Wonka that involves core members and some of their key partner organisations, especially their environment. They've got a group of environmental doctors, as they call them. Perhaps build, again aspirational, build a global map that indicates appropriate heat health tools and products sensitive to different climate regions. What's emerged from this meeting is some clear evidence and understanding that a one-size-fits-all approach is not appropriate. Maybe the heat health products and tools need to be sensitive or acknowledge the nature of the climate region. So, for example, the wet humid tropics versus the mid-latitude temperate climates, and maybe different indices that work better in one climate region compared to another. Create opportunities for regional partnerships, regional partnership discovery and collaboration. So perhaps through a regional Jin workshop, Jin nodes and meetings, and maybe contemplate the development of a regional partnership tool. In very simple terms, this might be a bit like a dating app. Anyone use a dating app? I'm happily married, so it's a big no from me. But this is basically, we can think about what a partnership tool might look like, a dating app for heat partnerships might look like. And lastly, going back to this whole idea of case studies, identifying 2 or 3 case studies that describe the journey taken by a set of partners in establishing an effective multi-agency, multi-partner approach to managing heat. And that's it from me. Thank you very much.
Any questions for Glenn? Comments? Virginia?
Thank you for a lovely summary. It was a good session. I really enjoyed it. Thank you, Glenn. I just wanted to mention that COP25 will be in Costa Rica for a pre-meeting and in Chile for the main meeting next November. We haven't yet formally heard about where COP26 will be.
Okay, thank you.
So I would like to suggest maybe we can approach C40 because C40 is very important in the national organization. The mayors there, they will commit to do something at the city level, and also they will tackle this kind of climate change things. So I believe heat health is a very important issue they should bear in mind. So I think maybe someone can help us to approach C40. Thank you.
Yeah, good idea.
Pardon my ignorance, but apart from chocolate, I don't know what Wonka is.
Sorry, this is the World Association of Doctors. Family doctors, my apologies, yeah. Yeah, so they're a truly global network. I forget how many members there is, but it extends into several thousands. And the point that was made in the presentation from Dr. Donald Lee, who's the president of Wonka, is that all the members of Wonka are on the ground. They're on the front line. They're dealing with people on a day-to-day basis. They have a good depth of trust with their patients. So this serves as a kind of a logical avenue to convey information about heat health issues. So we see them as potentially an extremely good partner, very grounded. They understand health issues on the ground, and indeed they're global as well. And I think from the, excuse the phraseology, but from the body language of Dr. Lee, the president of WONCA, he's very receptive and open to working with Jin around the whole issue of heat and health. And it's an issue which I think WONCA recognises as having already emerged, not an emerging issue, but it's emerged and it's in our face, and it's important that we start to deal with it now. That's a long explanation of what WONCA is.
Glenn, with this long explanation, I would like to add another NGO, which is also relevant to this topic. It's the Global Health Alliance on Climate Change and Health. With regard to the COP23, which took place officially in Fiji but held in Bonn last year, there was a one-day event of this Global Alliance. And this Global Alliance has turned in some countries into national alliances, like the alliance in UK and also in Germany last year. So it is an association coming from medical doctors and general practitioners particularly, and this fits quite well to WONCA. So please bear in mind this additional NGO.
Okay. That's excellent, thank you.
So time for a quick one more. We talked very briefly about perhaps the need for economists, and the comment just now has made me think that perhaps some key players in the broader climate change agenda, like Munich Re, who have been very powerful, the insurance industry, might be good people to approach, because they're already keen to engage in this space in general, but maybe need to be made more aware that there's now a specific heat network to engage with.
Do you have the connection there?
Yes, I can make that connection. Perfect. Okay.
I will just say on that subject, I didn't mean to put Elspeth on the spot, but in this session, I happened to be in this one for almost the whole thing, amazingly, and almost all of the actions had specific people associated that said, yes, we can, get this gin in the early morning, and Virginia offered to help with Sendai, and Montira is going to help with the New York colloquium, and Julie Riggi is going to eventually tell me the right name for this urban adaptation thing that I keep forgetting. World Urban Forum. Yes, I got it. Okay. So we have names of people that have already got connections, and I think with some of the other sections we do as well. So in the action plan, it will be a general action plan, and then we're going to have a version that names names and follow up with you on that. So that's part of being the network. You get to help build it. So, okay. Next, we had yours up here on the. All right, so you know that we had a survey, and thank you to those of you who actually took the survey. We had over 27 responses, but it's still online. And so Hunter's going to do a bit of a summary of what we actually found in the survey and what you all saying. So part of this is just really, multiple ways of hearing from you. There we go. I'm doing this for you. How about that? That hardly ever happens. All right. Thank you. No, you guys. We're going to have to. No. It's an unruled.
Okay. Yes, I'm here to represent the voice of the people. It's only 27 respondents, so there were over 100 of us as of early lunch. I saw more roll in, but this is just an initial preview to give us some ideas. You can still influence this if you want to go and put your comments in there. I have the link on every slide. Okay. So first, who are you? Or at least who's responded so far. It might be that research scientists are just really good at filling out surveys really quickly. So we have mostly research scientists, that's like 66%, but there are a number of other categories of people who have been able to respond. Where are you from? Predominantly Europe, and then South and Southeast Asia. So help us balance that out with more responses. Okay, some of the questions. What are some of the most important things that would make your work easier and more effective? These are just the top 5. There were a lot of other options. So number 1 was expanded interdisciplinary network of related practitioners and researchers, followed by greater access to project funding, that's always important, stronger government mandate to specifically manage heat risks, greater opportunities to become part of collaborative projects and meet others to partner with, and more useful information and decision tools. The next question was about strategic priorities for GIN. Overwhelmingly, we got them right. There are a couple of additional suggestions here, so that was very helpful. Next, what do you think the network should focus on? I just put the highest ranked one, so I just basically, it was a response from, you could pick 1 to 5. And so I just kind of averaged all of the responses, and these were the top ones. So you think the network should focus on creating opportunities for networking and information exchange, raising awareness of governments and donors of the problems and solutions, translating and synthesizing evidence into actionable guidance, promoting the generation of evidence of effectiveness and of actions and interventions, and then convening technical meetings and work teams. Number 3, what services would be the most important for this network to provide to its members? The top 3 were a synthesis report that identifies research and operational gaps and needs, best practices, etc. Number 2 is an online knowledge sharing platform. And number 3 is evidence reviews and inventories of good practice. So I think that's, again, coming back to some evidence. If an online platform existed, and it sounds like you want one, what would be the 3 most important features you would look for? And number 1 is a synthesis of new findings and studies. Number 2 is guidance and resources. And then number 3 is inventory of effective interventions. The next question is, what are your top motivations for engagement in GIN? So the ability to keep up with the latest science and innovations. I heard a lot of really interesting science here. Also the opportunity to connect with others in your field, and then to connect with others in other fields. So hopefully we're able to accomplish a number of those things here. Did we? By attending the forum, did it allow you to, and then I have there were 5 questions, but 4 of them had the strongest responses. So identify new partners and identify new resources and tools to improve your work. 2/3 of you felt like we did accomplish that here. Learn about a new body of work connected to yours and plan any new collaborative actions. Still a strong response, but a little bit less. So these are things that we can work on for future forums. What would be the most useful level of connecting to others? Encouragingly, with countries and contexts similar to your own, but in other world regions. That's a really great finding for us to have. And then globally is second, and then less so within your own region and within your own country. And yeah, I'll leave it there.
All right, so it's still online. How long is it going to stay up? Do we know? Yeah. So we're gonna leave it up until the time that we're gonna ask you for your comments back in January. How about that? Okay. Now we have Joy's gonna try and do a bit of an overview for us of the key findings and what we think we heard from you all in the big picture sense. You want the draft statement? Closing. Okay. Yeah? Okay.
Thank you. Wow, I have just been overwhelmed by this week. We started on Monday, and I warned you this was not going to be a normal science meeting. And so I hope that your expectations have been fulfilled. Mine certainly have been. And, you know, I think one of the key messages that I hope we've answered is, who is GIN? And I hope you all now understand that GIN really is you. The network is you. And as I said on Monday, setting up a new network is all about responding to your needs. The shape, the size, the priorities, the activities, the drive and pulse of a network needs to be driven by you, by each and every one of you. And so the activities, the priorities that we're setting out here, we hope that they do reflect your priorities. And when we say we want to do repositories of good practice, we want to connect people up, we need you to be contributing your good practices, your examples, your new findings into these repositories. Because if we don't have strong engagement, if you're not actively sharing your advances, we can't advance together. So it is really important that we get the right activities, the right priorities that are meaningful to you and that are helping you do your work better, or we're headed down the wrong track. And so that's why we wanted to have this consultation. We wanted to have this discussion to make sure that we understood what are the priorities. Because there's nothing worse than setting up something that's not going to be useful, that gets out of date within 2 years. We wanted to make sure that we don't make those mistakes, because this is a really important issue. It's important to all of us in all of the different work that we've heard this week, and we want to make sure that whatever we do is time and resources well spent to support you and propel you and your advances to make a difference on this subject. So, with that little intro, we've heard fantastic inputs for and ideas of what can and should be done. And we are going to consider that and think of that and come back to you. But we know that we can deliver on a few things. And so I wanted to share with you what you can expect, what's going to happen out of this meeting in the next couple months. We know that we are going to be very quickly in January putting together a meeting report. We're going to set this out as the basis of a synthesis. Hopefully it's going to provide the basis that we can update then at regular intervals. But this will really be the founding synthesis of the state of our professional experiences today. That's what we're hoping to do. We still have to figure out the shape and size of that, figure out the full resource requirements, and do something that's practical within those means. We're going to be working on disseminating the outcomes of this meeting. We've already identified a few publications that are coming out this year that we're going to collaborate with to make sure that we're getting that message out. And we're going to be looking for other opportunities and publication to promote that as well. One that's been mentioned is that the global platform for ISDR, for the Sendai implementation, will be held in Geneva in May. And so we're hoping to organize a side event specifically looking at heat within the disaster context, where we can again promote and share and engage others in our endeavor for heat risk management. We will be developing a consensus statement out of this meeting that we will take back, particularly to the WHO, the WMO, sponsors of this meeting, who are interested to know what's required in this space and what does it mean institutionally for the member states of both of these organizations, and how can those be leveraged to again address your needs. So we'll be producing a report back to those organizations. We're going to be following up with a lot of you who have said, I want to collaborate on this, or we think it would be fantastic if we could team up. So we'll be chasing and following you up over the next couple months. We've already said that we need an action plan. There are so many activities, many of them already in course, and others that need to come together to say, how can we find funding for a collaborative research, or where can we take this? We need an action plan. And so that's what we will be teasing out from all of the good ideas, to just give a little bit of structure to that and share back with you to say, here are the priorities that we should collectively be aligning on. And then, as has been mentioned, and I'm really glad that everybody thought in the survey that a portal would be a good idea, because actually we've already received funding from the Wellcome Trust to be able to develop this in 2019. So we will also be coming back to you trying to understand the user requirements. What should go into this portal? We'll be beginning the user design consultations early in January, so this is something that we hope to move quickly with over the next year, and we'll have a place to host these repositories. We will migrate the current GIN site into something else, And so you can expect that that online space is going to evolve, because obviously that's going to be a key to communication and sharing for the entire network. And then I think we can promise you that we can come back in about 6 months and have a webinar and share what progress we've made. Share with you these draft action plans, get some feedback. But again, we want to be transparent. We want to be engaged. We need this conversation to make sure that we are on the right track and we stay on the right track. We capitalize on opportunities. And again, I think our organic motto that has emerged is that we need to go farther, faster, but do it together. We also know that there are a tremendous amount of other opportunities that are ongoing. And I couldn't even start to fit the list of what I've heard could be potentially leveraged and done in collaboration with Gen partners. But I think this is a list that we should endeavor to expand. But we know that the risk communication simulation that many of you just participated in, that's going to be turned into a training manual used by the WHO in all of its regions, made available to those regions to do further training. So thank you for being the guinea pigs in that exercise, because again, we're going to try and be sharing this further. Also mentioned that the WMO is developing guidance on what are urban climate and weather services. Chao Ren is part of that, and Hong Kong is a pilot city for that already. We know that we're going to want to continue working with Chao and bring in this conversation, the requirements and needs of this community to manage health risks specifically in the urban context within that. So I think this is something that we should work on expanding. Now, what's also really important is that we leave this conversation on the same page. I think I just closed the critical window. There we are. So it's important that we leave on a common page of what have we achieved and what do we all feel is the common direction forward. So we've drafted very quickly today a provisional outcome statement. We're going to post this online, and we would like your comments, your affirmation, your questioning it by the 10th of January. So we'll be circulating these documents to you. But we feel we had a very strong response that everyone did feel like a network in this area would actually be helpful and necessary to advance our common work. Because we did question, is actually a new network, is this worth doing? It's going to be a lot of work. It's a big endeavor, what we're saying we're going to do. It's quite an ambitious one, and we realize that. But we wanted to make sure, again, it's going to be worth the while, and I think we did hear that positive response. So these are what we heard as the consensus, that we do need to improve awareness of this silent emergency together, that we do need to strengthen the opportunities and resources for population protection of this specific risk, that we need to be strengthening partnerships across multiple levels and disciplines, and that we need to become more effective communicators about these risks so that we can all work together in managing them more effectively. We've also discussed that these 5 technical areas of work are fairly useful ones for bringing us together in a way that breaks down silos, that forces us to think about the interactions not only between the different technical areas, but also how we work together. And then the recommendations we would like to propose is that this community affirms the need for a proposed network and recommends that if we're going to do that, we also need to request coordination support to actually bring us together. that we also recognize the importance of some of these member state organizations responsible for health, responsible for meteorology, to also listen to us as a community. And so this forum encourages the WHO, the WMO, as well as other organizations to look to the GEN community and implement the necessary actions and build upon the partnership that we've created as a community for some of the common goals that we have, particularly the common goals for the Sendai framework, for implementing the Paris Agreement, and the Sustainable Development Goals. These are all important national policy frameworks. It's a common backbone that does tie us together, and they are important agreed targets that our governments have signed up to support. Also, that we call for the creation of opportunities and enabling environments, such as these mandates and agreements within governments to work together, to share data, facilitate the resources to allow us to technically collaborate is going to be important. And so there's also calling out some of the specific gaps. We realize that occupational health is really a particular target area. We need to be thinking about worker protection in a substantial way, and that's something that's falling between the cracks at the moment that we probably need to draw attention to. Also the issues of the urban complexities. So I'll leave you to reflect on this, but wanted to share with you that this is what we are proposing, as well as to end with that we will be working on a draft action plan within the first half of 2019, and that we will share that back with you for comments and, of course, confirmations of that. So I'm now going to ask Julie to put us back on schedule. Yes, that was your part.
Yep. Okay. Thank you, Joy. All right. At this point, I'd like to ask the steering committee members to come back up onto the stage, because we're going to have a little session. Margaret, are you going to come down here? We'll make this pretty quick because we're already pretty much out of time. But this group, this interim steering committee, it's been about 1.5 years in the making. And first of all, I think if you haven't met them by now, I want to make sure that you all know who they are, because this has been a labor of love on behalf of everybody who's diligently been patient and done calls at odd times of the day for 1.5 years or so now. Come on up. You're going to talk to us. Chairs. All right. Now we'll sing a song. Kumbaya. All right. So, yeah. So, if you don't already know, we've got Shubayu Saha from the Centers for Disease Control in the United States, Virginia Murray from Public Health England, and Sendai Framework Disaster Risk Reduction Extraordinaire, Andreas Matsarakis from the German Met Service, Hannah Nissan from the International Research Institute for Climate and Society, Kumar from Rupa Kumar, oh my gosh, sorry about that, from the WMO. We've got, I'm going to skip over you, Hunter. I'm going to skip over Joy. We got Julie Origi, is that you down there from the Red Cross? Chow Ren, all right, we've got words for you, Chow. Glenn McGregor from Durham. And who's over there? Oh, Shari Kovacs from London School. So there are a couple others who are not here, I think, but I just wanted you to know and who's responsible for this in part. And I also just wanted to thank you all. I feel partly responsible for your being here, because the GIN came out of that Chicago meeting, and we needed a network of people to help us figure out what this whole network should look like. So from me to you, thank you all very much. All right, so now we're just going to take some questions, and Margaret's going to lead us through just a little bit of a dialogue so that you can ask the entire steering committee, tell us anything you haven't heard or had a chance to say yet.
Sorry. So the point of this is it's your opportunity to have the last word, because we've all been talking at you, so now it's your chance to ask everybody who's organised this or say what you wish to say. Last chance, 15 minutes, and then we're throwing you out. Okay? My job is to be the bully. Okay, you got your hand up first. Over there. Got the microphone's coming, it's coming, it's coming. And then you're next.
I'll start with an easy one. Thank you so much for finally a meeting that doesn't look like any other meetings. And is the last meeting of the year, no less. Thank you for that Christmas present.
Okay, over here. Here, that's.
Also, I would like to thank you for the tremendous work, and it was a real privilege to be here. My final question to all of you is, how do you want to deal with the presentation slides? Because this is also a tremendous information source for us, for the participants, and I think lots of them, including myself, are keen to learn and to reflect some of these sessions. How do you want to deal with this?
Who's going to answer?
Okay, so we will be updating the website and migrating all of this information. Migrating all of the information into a proper meeting page, and we hope to also be directing. Okay, anyway. We have been quite diligent about collecting all of the presentations, all of the posters in digital form, so that we can make this all publicly available. So we're going to get to that hopefully quite soon, not later than early in the year. What? Okay, is the question about publishing presentations which may have non-published data in them? Is that the question? Okay, because I think we did ask for a disclaimer to note to us, if you have presentations with non-published data, to send us a clean version in PDF that you feel comfortable sharing, because it is important to share.
Hello, Lars Nybo from Copenhagen. First of all, I also would like to thank the steering committee for kickstarting and starting this forum. I couldn't help noticing that the last point was to arrange a meeting within 2 years, and I have unofficially proposed or offered to host this in Copenhagen, because we have the opportunity to provide the venue for that. Of course, it would be in collaboration with the steering committee in arranging and so on, but some of the work could integrate with some of the mentioned WMO, WHO report that we will have and bring people together. Strategically, it would be clever to have it in end July, perhaps, because heat will be pleasant in Copenhagen, but it will be an issue worldwide, and that could maximize the impact from such a meeting, that media attention from policymakers would be immediately perceived, because they will experience heat around in the world at that time. But it's just an offer, so you can discuss it, but it will stand.
I'm making. Anyway, first up, thanks a lot to the steering committee for a wonderful format and a very wonderful gathering of different experts. And every good thing was good. In the final recommendations, I find two things missing in my perspective. Very little mention of communication issues. If that can be strengthened, the communication of the heat health warning. And the second point, maybe I'm biased towards that, the rural community is not that well represented here. Maybe I work with the farmers and the animal sectors, I'm biased towards that. They are equally vulnerable, information do not reach to them as quickly as it reaches to the urban areas, maybe urban poor also. Can we find it somewhere in the recommendations? These are the two issues. Thanks for everybody. And no competition with Copenhagen. Have at least 2 offers from India. So next to that can be considered. Two institutions have informally asked me to convey this message. They're ready to host it. Thank you.
Thank you. I am Jerome Fossé from the German Red Cross in Vietnam. First, I want to say thank you very much for this very amazing seminar. Thank you very much for inviting me and for organizing. It was great. I look at the first result, and there's only one person who is from the humanitarian sector. Is me, actually, in the countdown. So I hope more will answer, but it shows a bit of disparity. We have about, I think, 25 persons who are in science and only one so far who are from humanitarian sector. So I think it has to be addressed somehow. And my second comment is about the format. I think it's very good to have very science-based presentation, but I as well enjoy very much when we have dialogue like this afternoon. You know, like of smaller groups, like 10, 5 persons who can speak together and share maybe in a more informal way. I think we should have maybe a more balanced way for the coming events. Thank you.
That looks like it. Would anybody in the committee like to make any further responses? That looks like it. I think it's time to sing Auld Lang Syne.
Almost done. No. You guys have to stay for 1 second, because there are a couple folks that, first of all, thank you all to the steering committee. I've already said that. But I think we as a steering committee have to thank a few people as well. Hope you're both there. Yeah. So I was standing in a meeting the other day, and we were wondering how we were actually going to get all this done in real time here. And so a colleague of mine who has a couple of AAAS fellows, Judith Ungari and Makeba, come on down, Makeba Charles Allende. So they agreed to come about maybe a week ago and have been doing a yeoman's work, taking notes so when we say we will have the information, to be able to go back and make something out of it. Thank you both very much. You're part of the team now, so thank you. And then prior to that, Robbie, who I think most of you have seen, who's been wearing many hats. Robbie Parks was working with Joy at the Joint Office for quite a while, along with Nate. Where are you, Nate? All right, Nate. So they were around in the beginning and helped get the synthesis report, helped get Jen's sort of concept off the ground, and we're really, really happy to have you both back in the family for this event and for all of the work that you've done, both getting ready for it early on and especially here. I don't know how many hats all of us have worn, but you guys have done an amazing job. And then, where's Lucas? Lucas, how could you not? Okay, there you are, right in front of me. So if you didn't know Lucas before today, I'm sure you do now. And he came in and picked up where these guys left off, and then took the ball and ran with the communications day, and then really helped cultivate, you know, with Margaret and with Red Cross, the whole concept, and then helped pull the entire effort together. And you guys have no idea how many times of day and WhatsApp conversations. You have no idea. I mean, you have no idea. So, so Lucas, thank you very much. Congratulations. And then last but not least, if you haven't figured out who Hunter Jones is yet, Hunter, please stand up. Hunter needs the biggest round of applause. He's been around since the Chicago workshop with me, stalwart, steady. You've probably gotten so many emails. I don't know how he keeps track of all the emails that we all send, that he sends to us, that you send to him. honestly, this meeting would not have come off without the list of people that I just named, and especially Hunter, who's been here from the beginning through everything. If you haven't figured it out, really grateful to him, especially because he's been around for the longest time and hasn't wavered a second when he could have been really annoyed at any point along the way with any one of us, and probably was, just handled it very gracefully. So Hunter, thank you very much. And I might be a little biased because he works with me. All right, so he does still have a full head of hair. Yeah, well, I'm working. Yes. There you go. Now, Brian, if you haven't seen, everybody knows Brian by now. Brian and I go way back. Thank you so much for making sure that all of the logistics and everything went smoothly from the steering committee side. Now, there's a whole other piece to ask, to thank here, but Brian has been helping us get this meeting planned and worked with the local organizing committee on a regular basis, as did Hunter and Lucas and all of us. I mean, it really, the team effort required is unbelievable behind the scenes. And Brian, thank you very much for making sure everything goes smoothly here, went smoothly here, continues to go smoothly. So, yeah, thank you. And then last but not least, I'll thank Joy, because she's been a partner in crime from the beginning. And she didn't even make the Chicago workshop in the end, but boy, did you get the aftermath of that, didn't you? Yes. Thank you, Joy, for taking the leadership on this gracefully and so adeptly over the last year and a half or two, and leading us into this amazing new network. Why don't you come on up and take it away from here? Thank you, Joy. And finally, the labor of love also got contagious all the way to Hong Kong, because without Chao Ren working with the University of Hong Kong and the Chinese University to actually secure the original grants that allowed us to be hosted here, it wouldn't have happened. It really wouldn't have happened. And she has put together the amazing local team of all of the partners, which we knew had existing strong collaborations in heat and health. And that's really why we wanted to come here and meet you all and get to know you as part of the GEN family, because we know you're doing tremendous interdisciplinary work already across the city. And so I'd like to thank everybody on the local committee, the Red Cross, the Hong Kong University, the Chinese University, all of your different faculties that you roped into this, and of course the observatory that have just been essential in making this happen. And last but not least, also our communications advisor, Margaret, who we also roped in and said, we've got this tremendous opportunity happening that you have to be a part of. And so we have carved out a little of her time from the global Ebola response, and we really appreciate you being here with us and championing the communications work and leading that way.
Can Hong Kong youth team just stand up and also show your hands?
I was getting there.
We got a lot of support from the faculty office, and also Dr. Jianxiang Huang, our assistant professor, also gave a lot of tremendous help for this. And also our IT staff, technician staff, they give the live stream possible, right? Make it real. And also Doris, thanks so much for everything. Yeah.
And of course, in reciprocation, I have to acknowledge my partner in crime that I've been working with for the last 10 years, and we have finally found, we've worked on many things together, but when we came, this idea organically emerged in 2015-16, and we said, we have to go for this. We have to make this happen. So I'm really glad that you all have joined us on this journey, and I look forward to getting all the postcards and seeing where we go.
So thank you all again for being here with us, and please travel home well, and we will be in touch.